As I mentioned in my opening statement, your background and experiences bring a fresh perspective to the role of CMS administrator. As an accomplished physician, you have firsthand experience not only with the bureaucratic nature of federal government payment programs, but also the impact of chronic disease, as you've discussed in your statement. I'd be curious if you would just expand a little more on your vision for CMS and how you would integrate nutrition and lifestyle-based interventions into our healthcare system.
Senator Crapo, when I walked into your office, you gave me an Idaho potato chip. You also gave me a large potato, but that's where those potato chips came from, and nothing else was added. If you look at the ingredient list, it was a potato and a little bit of salt. You also had yogurt in your office, which was low-fat, flavored, and I would argue not as healthy. The average American has a difficult time making that choice, and we'll often incentivize products that aren't as healthy for the American people, which is confusing. One of the points that I mentioned at the end of my opening comment was that if we gave people in their hands tools, resources that are useful, not information, but tactics and support teams that could work with them to improve their well-being, many would take advantage of it. I pointed out obesity, which is 43%, and that's not overweight, that's obesity. Those folks want to lose weight. There are many reasons they don't, but part of the reason they don't is they don't have support teams built around them. They don't have lifestyles advice that they can implement into their life day in and day out. For anyone in this committee who was able to go running or exercising for 20 minutes yesterday, you probably did the equivalent of reducing $100 billion of expenses for Medicare and Medicaid just by being active. If Americans would do that every day, that's what we'd experience, but we haven't done that. One tactic that I believe will work quite effectively is if we can get real-time information from physicians and other health providers taking care of patients, and using that real-time information, give feedback to people who are worried about their well-being. That's when they're more likely to use that advice. That tool would allow them to both call an expert if they needed that resource. We'd provide them tools to do that. We'd reimburse some of the healthy lifestyles that would be generated by these interactions, and we'd make them an active participant in their well-being. I think that dramatically changes the power dynamic. It makes the American people feel like they actually can be the world experts on their well-being.
Thank you. I very strongly agree with your focus in these comments on lifestyle-based interventions that can actually help people help themselves to get much more healthy. And I'm also interested in how you might reform our payment programs to become more efficient to serve both patient lives and to save both patient lives and taxpayer dollars.
So when I sat with Senator Wyden last night, he asked about a similar issue, which is pre-authorization. We spent about 12% of the CMS budget on bureaucratic processes, the administration of the program. And most of that money is taken by middlemen in ways that I don't think need to be true in the long term. I believe we have the power right now with technology that didn't exist even 3 or 4 years ago to automate a lot of these processes, and pre-authorization is a good example. There are about 15,000 procedures that go through pre-authorization. Insurance companies in aggregate probably have 5,000 they'll list, but they only have to have about 1,000 in order to truly make a difference and make sure that the right procedures are done in the right way. We should be able to create an experience for physicians and patients so that we know almost immediately if what they're going through is requiring a pre-authorization, and if it does, what do they actually do to qualify for it? That could be instantaneous. By doing this rapidly, we cut out several % of administrative costs, deal with the intense frustration the American people have with pre-authorization, which was raised by many members of this committee, and we actually improve the care of people without costing or taking money out of the system. Those are the kinds of advances I believe we can champion.
Thank you. That concludes my questioning.